You've got burning questions, and I've got answers to all your frequently asked questions about myofunctional therapy. I'm Carice Laguerre. I am a key opinion leader on all things myo and sleep in the dental space. I am a former clinical dental hygienist. However, I don't work anymore clinically. I only do myofunctional therapy, and I teach and lecture significantly on the topic. So I am here to help you navigate your way through, because I get it. There is no standardized path. It's nothing like becoming a registered dental hygienist where you know exactly what you're supposed to do and what are the steps to get there. So here are the top 10 frequently asked questions, and I might have a bonus one for you. What is myofunctional therapy and how does it differ from clinical dental hygiene? Myofunctional therapy was actually founded in the early 1900s. So the earliest 20th century, Edward Engel, as you might know him as being the father of modern orthodontics, Engel's classification system, he had a very prominent student who was super interested in trying to figure out why is malocclusion even a thing. Over time, Dr. Alfred Rogers, who was the student of Edward Engel, actually wound up doing a significant amount of research. And by 1918, he had authored over 50 articles about soft muscles, soft tissue function, and how that impacts our hard tissue structures or the craniofacial skeletal complex. And so what he discovered is that the soft tissue pressures of the lips, the cheeks, and the tongue actually do impact the way the teeth are able to come into place. And so that's a big factor in malocclusion. Well, since then, in the 100+ years since myofunctional therapy has been a thing, it's actually diverted a little bit away from dentistry. In fact, it's a little disappointing, and dentistry, as we know, is an evolving field, but it's been super slow to kind of move and integrate into the path that we need it to. We've actually gone backwards and started focusing more on the alignment of the teeth. What's your classification? That's not the important thing. It's actually the facial aesthetics and the facial function. And dental hygienists are key. We are the absolute best professionals to be looking at oral function. In fact, we are the second most visited, just behind the pharmacist, but second most visited healthcare professional by healthy adults in America. And so we're looking at soft tissue, we're looking at all that function all day long, any intraoral, extraoral exam. However, being a myofunctional therapist is completely different from being a registered dental hygienist. In your clinical duties, you're taking x-rays, you're doing prophylactic treatment, you're doing non-surgical periodontal treatment and maintenance, you're doing a whole lot of things, period charting, you're doing all things that you do zero of when you're a myofunctional therapist. In fact, all you're doing as a myofunctional therapist is you are assessing and evaluating oral dysfunction and then remediating it. So helping to alleviate that soft tissue dysfunction and establishing new neuromuscular patterns. And so with that being said, it is a world of difference. It's absolutely night and day, and I am sure that we will come back to that a little bit later. Frequently asked question number 2, how does myofunctional therapy contribute to a comprehensive approach to oral health and overall well-being for patients? Well, I think we already know that there is a big connection between our mouth breathing patients and their risk of caries, their periodontal disease, their inability to really get good restful sleep. We know that these mouth breathing patients do struggle with a lot of nasal congestion and probably sinus infections that they come in and you're taking these PAs thinking something's going on with the teeth, but it's actually their sinuses. There is a world of difference that just the myofunctional therapist can do in helping to alleviate mouth breathing for the patients. Then on top of that, we have all the digestive components that are also a part of it. There are a lot of connections between mouth breathing because you're swallowing a lot of air as you're eating. You've got to breathe while you're eating. And so you wind up swallowing a lot of air there. There's connections to reflux, acid reflux, and that as well is going to be a component and a factor. But more related to dentistry, temporomandibular joint disorder, oral facial pain, a big muscular component is often compensatory patterns and dysfunction in those areas in the muscles of mastication. And so we find that myofunctional therapy is really helpful at helping to eliminate parafunctional habits and help to alleviate and sometimes 100% relieve or eliminate orofacial pain. And so it's a really, really wonderful adjunctive to have in your dental practice or to do independently and still be seeing patients in the same manner or similar manner in which you're helping them now. Question number 3, can registered dental hygienists practice myofunctional therapy independently, or does it require supervision by a dentist? This one is a very loaded question. I like to liken myofunctional therapy, let's put it to the side for a second, to like yoga or personal training. If you were to get a certificate as a registered dental hygienist in yoga or personal training, what exactly would that mean for you and your practice as a registered dental hygienist? Nothing. Right? Absolutely nothing. You can't go in and start working on people's biceps, triceps, six-pack abs. You can't go in and in the dental clinic, start working on that stuff. That wouldn't make sense. And you understand why, right? These two things are not related. You're not going to go to your dental board and say, hey, do you regulate yoga? Because no, they don't regulate yoga. And they also don't regulate myofunctional therapy. It is night and day, the two practices. It is in all 50 states as of the time I'm recording this today, December 2023. In all 50 states, it has not been written into any dental state practice act at all in any capacity. So it is not something that you do while you are in clinical practice. While you're using your clinical hygiene licensure and you're practicing working in a dental office, doing all the things within your scope, you would never stop to start teaching someone downward dog and to help them do yoga and or do personal training, right? You're not going to stop in the middle of your day as a clinical registered dental hygienist and start doing myofunctional therapy. The two have to be separate because there just is no overlap. A lot more on that in another video that I'll link below. Okay. All right, let's get into our question number 4. How long does it typically take to complete myofunctional therapy training, and what are the pathways that are available? I love that word pathway because we want a clear path to absolute proficiency and profitability. And I've got a wonderful course that I want to talk to you about as we move along in this video. However, how long does it typically take? As you start looking, you'll find that there are a number of courses. There's actually 6 courses that the International Association of Airway Hygienists does have up on their website, and I'll link that for you below as well. But when you look at those courses, it's really going to vary anywhere between like 8 to 10 to possibly 14 weeks long in duration. Some will give you more time. I believe in having more time. We are very clinical minded. Can you imagine going through all of your schooling, let's talk about just the classroom education for dental hygiene, and never once, not one day, having any clinical practice? You would feel totally lost trying to go into the field of dental hygiene. Well, that's a lot of times what I find happens when we have all these courses. It's been a beautiful thing, COVID, as far as us being able to learn how to work with each other over a distance, right? To watch videos and to learn and to educate ourselves. However, all these distance courses with not one of them offering any sort of on-site education or implementation or mentorship is a big, big problem for us who are very tactile. We want to see this in action. We want to be able to know how it applies to us, how we can do it proficiently. And so Myo Pathway is my recommended course that I would suggest because there's actually 16 hours of on-site mentorship, okay? So I think that that is a phenomenal way to go. We need longer courses. What are you possibly going to learn? It took you 2 years at minimum to get clinical dental hygiene and to really nail it down. And even after that, you felt unsure, right? I remember going into my first office in my job interview and I'm talking myself up and I'm like, I had 2.5 hours in that clinic. And now you want me to have like 45 minutes to an hour with an adult? I don't know what I'm doing. Why would you trust me with this, right? But with myofunctional therapy, I think that it's time that we start breaking down those barriers and those walls with those courses that are only going to take you a couple of weeks. And then what do you get at the end of it? You've had no on-site education. You have no idea what to do. And so you wind up taking another course. And so you're spending twice the money to get 0% better at doing the thing. And so Myo Pathway is a longer pathway, but a more consistent one to get you to profitability and to proficiency a lot. Next, number 6, what are the key skills or techniques I will learn during myofunctional therapy training that I can apply in my dental hygiene practice? Not everybody who does myofunctional therapy wants to leave and do their own independent thing. Some people want to do myo, but maybe only part-time or selectively. And a lot of times I have taught in the past people who just want to use it to help their children. I got into myofunctional therapy to help my 4 children. They had various issues that were all based around the way they were breathing, whether it was the ADHD, the obstructive sleep apnea, the tongue ties, the lack of breastfeeding. We had a full spectrum of all the manifestations of oral myofunctional disorders in my household. And that's what I wanted to really dive into. The money that I could spend in one course was probably like 1/6 of what I would have spent if I had to put all of them into the individual therapy together. So sometimes you just want to know what you can do with these skills in clinical hygiene. Great, because a lot of the education is really parallel. I really like to think that this is the most lateral career move a dental hygienist can make. A lot of dental embryology, oral pathology, you're doing intraoral, extraoral exams, you already know about oral function. You just really amplify a lot of that education when you take a myofunctional therapy course. So how can you apply that in your clinical dental hygiene practice? Well, now you're going to be exceptional at patient education and helping them to implement changes that can help them with dental treatment that they're doing, orthodontic treatment that they're doing, periodontal disease. A lot of parafunctional habits are actually what help to degrade the periodontium, and it is a big causative factor for all those patients of yours who are struggling, who are like, look, I bought the water pick, I'm flossing every day and using the water pick, and I'm brushing, I bought that electric toothbrush you told me to get, I don't know what else I can do, why do I still have gum disease? A lot of times it's not just all of the oral hygiene, it's some of the oral function that needs to be addressed too, in order to provide that stability and create a harmonious environment for that periodontium. So really great opportunity for you to start providing more exceptional high-level care, because you'll be able to talk to these issues in a much clearer, more effective way for your dental patients. Question number 7, are there opportunities outside of clinical dental hygiene besides doing myofunctional therapy? I get it. Some people are burnt out, absolutely burnt out, and there's nothing else you want to do with clinical, and you really would like to step out of the op and maybe into the front office or out into the field. There are plenty of opportunities. Taking a myofunctional therapy course actually just enhances your education so you can speak to airway-centered disorders, tongue ties, oral dysfunction much better. There are opportunities to work as a sales consultant for oral appliance companies, for laser companies, working in airway companies, education, and you can work for a lot of these wonderful corporations that are starting to advance these things as the field is growing. Then on top of that, you could also work clinically, but more in the front in the administrative role as a treatment coordinator for practices that are popping up left and right that are all airway focused. They need people to be able to adequately educate. That way their treatment acceptance can increase. We need treatment acceptance in order for practices to really thrive, and being able to speak to those issues better, or just being able to guide the patients better as a patient advocate, is a phenomenal way that some people have gotten out of the op. And so there are a lot of clinical opportunities, but there's also a lot of demand for the myo. So you can take it any kind of 2 ways. And that's going to lead me to number 8. Is there a demand for myofunctional therapy? Yes, a giant demand. And I know that from my own personal experience with my practice growth. I mean, I remember when I first started, it's an uphill battle just trying to convince people that oral dysfunction is a thing. And now people are contacting me just trying to figure out how they can work with me. And they want me to skip all the education because they've already done all their research. We are in the information age. With James Nestor's book, Breath, there has been such a surgence of need and demand for more integrative services that are really going to help with mouth breathing and helping to eliminate that. There's so many health benefits. So it is a phenomenal career if that's what you're looking for, okay? 8, are there any ongoing professional development or continuing education requirements for myofunctional therapists? Yeah, requirements, it depends. If you wind up getting certified, there are certifications that do require that you have a certain amount of continuing education every certain period of time. They self-regulate that. Now, certification is absolutely not a thing. There is no accrediting board. There is absolutely no accreditation with the U.S. Board of Education for the field of myofunctional therapy. So certification looks like a lot of different things, and it really doesn't mean much of anything. Absolutely not. There are plenty of people who are very, very successful who practice without doing any sort of certification at all, or certification courses, or even providing that stuff. That is not a factor. However, if you do get certified, just be aware that there are going to be continuing education things that you would need to pursue further. Now, with the continuing education, these are opportunities that are popping up everywhere too. There are courses and conferences and all sorts of things where they are looking to have all of the airway people kind of getting together and pulling together. Collaboration Cures is a big one with AOSH, which is the American Academy of Oral Systemic Health, the biological dentists. They also are part of that, the American Academy of Physiological Medicine and Dentistry. It's one big collaborative course. I know that Light Scalpel, which is a laser company, they also do their own conference and courses. There's a lot of different opportunities out there. Myofunctional therapy has their own conferences. There's a lot to learn, and you will continue to learn. Just like with dental hygiene, things are evolving. There's new equipment, new techniques, new protocols, and same with myofunctional therapy. So you will continue to learn, okay? What are the job prospects and career opportunities for registered dental hygienists that are trained in myofunctional therapy? What are the job prospects? This one is always an interesting one for me to answer because there's not a lot of job prospects. You're not going to go onto any of your job boards and find, hey, I'm looking for a myofunctional therapist willing to pay such and such salary. That's not it. Myofunctional therapy is not for the weak. If you are unable to really, dive in and make opportunities, create opportunities, you're not going to find opportunities. So some people create opportunities within a dental practice that they already are in. You might be working clinically where someone is actually starting to learn a little bit more and leaning more airway friendly. And you might be like, hey, doc, I would really like to take a myofunctional therapy course. If I do, is this something you would stand behind, and could we collaborate so that potentially this creates a lucrative opportunity for the both of us? That's a wonderful way to really get started. That's not everybody's journey. Some people have more difficult journeys where they're seeking out the people in their area. So you might want to use local directories, find out who are the airway focused doctors or sleep doctors that are in your area, because they may want to work with you and collaborate with you and have you come into their office, and or it'll be a referral collaborative relationship. So you'll create opportunities, okay? Ooh, 10, 10, 10. Is myofunctional therapy covered by dental insurance? And how does billing and reimbursement work in this field? Guys, medical insurance is like a dirty word. It's really not a dirty word. Absolutely not at all. But it is something that it is going to create a lot of issues for you. It's an uphill battle with insurance. If insurance billing is what you're interested in, there's a lot to navigate through, and it's not impossible, but it is something that if you're looking for an introductory course, you want to take one that's going to talk about medical billing. Otherwise, you're going to be lost looking for medical billing along the way, okay? Now, speaking of that, whenever we're talking about billing or reimbursements, we're really trying to ask the question about compensation, like how much will I get paid? Is this going to be something? It's like the friendly way to kind of skirt around that issue. Well, you as a myofunctional therapist would be reimbursed higher than dental hygiene as far as if you're getting paid hourly wage and so forth. However, there's a lot that goes into that. The responsibilities that you bear, what your roles are within that office, and if you are taking on any of the liability of any of the business expenses. So business expenses for independent hygienists who are working towards building their own myofunctional therapy practice, you will never learn faster that business is not easy than when you start to just invest in your own business, because you'll wind up with a lot of money down the hole and you'll realize very quickly, like, ooh, I'm not charging enough, or something's going wrong here where I'm not making the money that I desire to make. So you'll make a lot of mistakes along the way, but you can have a very profitable, lucrative career in myofunctional therapy where you would make more than being a registered dental hygienist. It's just a matter of navigating really well. So choose your introductory courses properly. Again, Myo Pathway I would highly recommend because these are topics that we go in depth on. So you ready for your bonus? What resources or support networks are available for registered dental hygienists interested in pursuing a career in myofunctional therapy? There's actually a lot of great resources. There's 2 Facebook groups I would highly recommend. One, RDH, OMT for the RDH is actually what it's called, OMT for the RDH. It's a wonderful group where you will have a support network of a lot of different hygienists that are at various stages of myofunctional therapy. Liken that to the Intentional Hygienist Facebook group. That is a phenomenal group as well. I will have links for all of that below for you as well. That way you can get that. However, if you're interested in a professional organization, the International Association of Airway Hygienists is the only professional association dedicated entirely to the advancement and the education of registered dental hygienists within airway and myo. And that is a phenomenal place for you to get monthly education, continuing education, and incorporated into your membership fee, and for you to get a network of support, mentorship, ask questions, and really build camaraderie within the field. So I would highly recommend either one of those 2 paths for you. And I am so thankful that you were here. Thank you for sticking around for the entire video. If you're still here, I hope those have answered your questions. If you have any other questions that I didn't think to answer, put them in the chat below. I will happily come back on, create another video, and help you along on your pathway, your myo pathway. Bye, guys.